how does physical freedom meet medical choice? And I think that a lot of times you were talking about, people going in and how they're having these kind of minimalist things like, we'll put the pad on your back and there you go. Or, which I know a lot of people who have had an injury and the kind of reaction is, oh, well, we'll just go in and fix the shoulder, it's day surgery, it's fine. And they don't have any other kind of fixed option other than like the surgery default.
Yeah.
So I'm just curious where those two things meet.
Yeah, that's a really good question, and a lot of people end up. A lot of people ask that question if they get frustrated with a type of conservative care. We did doc talks on this actually a while ago. When to get an MRI. So MRI usually says there's something else kind of lurking. There's a bigger pathology, a bigger tissue damage that's lurking. Making that decision, you have to exhaust as much as you possibly can good conservative care before there is a second option of going to a surgical intervention, a big operation, because once that happens, once you have a big operation, that doesn't kind of go away. And most of the time when we have a big damage like that into our tissues, because surgery is, it's a controlled damage to your body. Once that happens, there's scar tissue that happens, there's extra arthritic changes that can happen. There's going to be a lot of sensory input that is changed just because you have incisions at certain areas. Even the little pinholes, like an arthroscopic surgery, that definitely changes the inputs at a knee, at a shoulder. Those things change, and it's because it's so deep rooted. There's a lot of different mechanical changes that happens at that area once the pinhole's in there. But for people to know when to go from one to the other, meaning if there's definitely times when people need surgery, by no means a non-surgical doc. I think there's a time and place for all of that stuff, but the examination, again, going back to an assessment, going back to an examination, has to drive that. So there's things called red flag questions on our patient intake. So when we have our patient intake, or even on the gym side, the gym intake, there's questions that give us an idea of whether we can be successful or we need to ask more questions about. If there's people that are having, deficits, they all of a sudden can't use their hand, they have complete numbness in certain areas, that's like an emergent response. Like, you need to go see someone immediately for decompression across maybe a nerve, or you need to, figure out what else is going on there. If it is just pain, only pain that is presenting here, and pain is stopping you from going to the next level, that's not a clear indication to go to a surgical intervention. That means that you still have a shot of not having a surgical intervention, an injection, any of those types of things. It's a tricky one, because sometimes pain can be so intense that they need a reduction of pain now, and we think that a surgery is going to be that option. It's not a great option if you look at research and you look at back pain and you look at surgical interventions, or you look at neck pain or shoulder pain or knee pain. There's surgeries that there's like 50-50. Like if you have back pain and you have a surgical intervention, it could be 50-50 on whether it helps or not. I think knees, if you have a meniscectomy, you take out some of your meniscus. It's a little jelly pad that kind of helps cushion your knees. Within 6 years, the arthritic changes are, I think, doubled, if not tripled, for those patients. So is it worth rehabbing the crap out of that knee and trying to hold on to as much cartilage as possible? Or do you take it out for the short-term, reduction in pain and swelling and symptoms? I'm going to try to advise people as much as I can to exhaust the attempt of not going under the knife, just because I've seen so much of the bad things. Again, I'm not saying surgery is not warranted at some cases. I just don't think that pain alone is the driver of what should, make you have surgery.